Hi, everybody. Thanks for coming to the Vetmedology and Leading Veterinary Teams live webinar for ADHD and Neurodivergence in Veterinary Medicine and for leadership and support staff. So tonight we have myself and Suzanne Thomas here from Leading Veterinary Teams to go ahead and discuss this topic with you all. I'll be going over the anatomy and physiology of ADHD, as well as some of the support systems in place for veterinary professionals. And Suzanne will be going into the leadership aspects of the webinar to go ahead and discuss basically support tactics for staff members with ADHD and neurodivergence. So let me go ahead and share my screen here real quick and get into the webinar. Let's see here. Okay. All right. All right. So welcome, everyone. Thank you for attending tonight. Again, ADHD/neurodivergence in veterinary medicine for leadership and support staff. You can follow Leading Veterinary Teams on their Instagram page and at www.lvt.vet. And you can follow Vetmedology CE on Instagram, as well as at www.vetmedology.com. All right, so a disclaimer, the information provided in this lecture is not intended to replace the medical opinions of your personal medical/mental health practitioner. A little bit about me. I am a veterinary entrepreneur and philanthropist, emergency and critical care veterinary technician and educator, founder of VetMed Math, Stat Math, VetMed Rounds, co-founder of Vetmedology, and the executive director and interim director of education at Animal Emergency Fund. My personal neurodivergent journey, I was diagnosed with major depression and generalized anxiety in high school and diagnosed with ADHD as an adult in 2021. The things that I'll be going over tonight, different neurodivergent diagnoses, overview of ADHD, an overview of all ADHD, anatomy and physiology of ADHD, how do neurotransmitters work in the brain, symptoms of ADHD experienced on the job by veterinary professionals, ADHD superpowers in veterinary professionals, treatment modalities and their mechanisms of action, medical management mechanisms and coping strategies, and provider networks. So some different neurodivergent diagnoses are autism spectrum disorder. This includes what was once known as Asperger's syndrome, attention deficit hyperactivity disorder, ADHD, Down syndrome, dysgraphia, dyslexia, dyspraxia, intellectual disabilities, mental health conditions like bipolar disorder, obsessive compulsive disorder, and more, Prader-Willi syndrome, sensory processing disorders, social anxiety, Tourette syndrome, and Williams syndrome. So ADHD is a chronic condition including inattention, difficulty focusing, plus minus hyperactivity/impulsivity. You may or may not experience those things with it. Research has proven that ADHD is indeed an inherited genetic disorder. It's also based upon social and environmental causes as well, but those are less studied at this point in time, but there is a direct inherited genetic component to it. So the inattentiveness, difficulty concentrating and focusing, the main signs are having a short attention span and being easily distracted at work, making careless mistakes, appearing forgetful or losing things, being unable to stick to tasks that are tedious or time consuming, appearing to be unable to listen or to carry out instructions, constantly changing activities or tasks, having difficulty organizing tasks, and the hyperactivity and impulsiveness main signs are being unable to sit still, especially in calm or quiet surroundings, constantly fidgeting, being unable to concentrate on tasks, excessive physical movement, excessive talking, being unable to wait their turn, acting without thinking, and interrupting conversations, and little or no sense of danger, so risk taking. So, an overview of all ADHD. All ADHD is a relatively new term that combines autism and ADHD. It is estimated that 30 to 80% of individuals with autism spectrum disorder also have symptoms of ADHD, and up to 20 to 50% of individuals with ADHD may also have symptoms of autism spectrum disorder. So you can see here from this chart that basically the overlap of ADHD and autism basically, manifests itself in these ways. So I'll give you guys a second to read through that. See if you find anything new about yourself. Okay, we're going to go ahead and move on. All right, so the anatomy and physiology of ADHD. ADHD causes differences in brain structure, brain development, and brain function. These differences relate to brain size, neurotransmitters, and brain networks. The careful growth, positioning, and organization of neurons, the brain's cellular units of communication, into working brain networks. And the brain networks of people with ADHD may take more time to develop and be less effective at relaying certain messages, behaviors, or information. These brain networks may function differently in areas such as focus, movement, and reward. So the first area of the brain that we're going to discuss is the prefrontal cortex. This region controls high-level functions regarding attention, executive function, and organization. Some other functions are the ability to balance short-term rewards with long-term goals, considering future and making predictions, focusing attention, organizing thoughts and problem solving, forming strategies and planning, inhibiting inappropriate behavior and initiating appropriate behavior, simultaneously considering multiple streams of information when faced with complex and challenging information, foreseeing and weighing possible consequences of behavior, shifting, adjusting behavior when situations change, modulation of intense emotions, and impulse control and delaying gratification. The next is the limbic system. This region is located deeper in the brain. It regulates our emotions and attention. The hypothalamus, pituitary, amygdala, and hippocampus all deal with basic drives, emotion, and memory. The hippocampus is responsible for memory processing, the amygdala, aggression, fight, and fear, so fight or flight response, and the hypothalamus, hunger, thirst, body temperature, pleasure, and regulates the pituitary gland or hormones. All right, so the basal ganglia, a deficiency here can cause interbrain communication and information to short circuit. That results in inattention or impulsivity. So voluntary motor activities include planning, programming, initiating, and maintaining, and regulatory functions basically control cognitive thinking, emotional functions, voluntary control of eye movement, but it's also responsible for procedural learning and routine behavior or habits. The reticular activating system. This is the major relay system among the main pathways that enter and leave the brain. A deficiency here can cause inattention, impulsivity, or hyperactivity. So it's responsible for controlling the sleeping, waking, and attention span of someone. It's a sophisticated filter. It screens out the junk, acts like an executive assistant, and allows you to focus on what you value, allows you to perceive a threat, and supports you when you set goals. So ADHD brains have low levels of a neurotransmitter called noradrenaline or norepinephrine. Norepinephrine is linked arm in arm with dopamine. Dopamine helps to control the brain's reward and pleasure center. So dopamine's main function is involved with reward and pleasure, mental alertness, appetite, and motivation. Signs of imbalance include lack of pleasure, apathy, low motivation or enthusiasm, likely to procrastinate, mental fatigue, slow response, memory loss, impulsiveness and thrill seeking, low libido, and restless leg syndrome. Norepinephrine's function is to stimulate the fight or flight stress response, energy, arousal, concentration, and vigilance. Signs of imbalance include brain fog, inattention, lack of focus and concentration, low mood, lack of arousal and interest, aches and pains in the body, headaches, rapid heartbeat, blood pressure. So, how do neurotransmitters work in the brain? At the tip of each neuron is a small gap, which is called a synapse. For neurotransmitters to send messages to each other, the signal needs to jump across the synapse from one neuron to the next. This process is called neurotransmission. What makes this process slightly more complicated is that a receptor on the end of the receiving neuron can only bind to a specific neurotransmitter. The neurotransmitter acts as the key, and the receptor acts as a lock. These two fit together in order for the signal to be passed on. This process can be complicated if the brain is creating too much or too little of a circulating neurotransmitter, or if there's a dysfunction in the amount of that neurotransmitter being collected by your neural receptors. So we can see to the right that, the receptor that is shaped in, or the neurotransmitter that is shaped in the shape of the receptor is a fit, and other neurotransmitters are not, basically. So, symptoms of ADHD experienced on the job by veterinary professionals. This is actually taken from a poll on Facebook from many veterinary technicians that they said that they experience on the job as being someone that has ADHD. They feel overstimulation, easily distracted, anxiety, difficulty with task prioritization, executive dysfunction, multitasking, medical math calculation hyperfocus, feeling triggered, difficulty with organization, hyperfocus, completing tasks, forgetfulness, lack of attention to detail, procrastination, hyperesthesia for light sounds and smells, justice policing, forgetting what you're working on, personality differences, being less personable or rejection sensitivity dysphoria, arriving to work early or late, imposter syndrome, which is self-confidence issues, and impulsivity, and more. However, there were some superpowers that they identified as well in working as a veterinary professional, and that was critical thinking in an emergency situation, communicating on a topic we're interested in to owners or other staff members, monitoring anesthesia, doing lab work, table cases, which meant honing in our attention onto one task, reading an animal's body language, so our nonverbal communication skills. Treatment modalities and their mechanisms of action. So the different types of therapies are here. So first, there's psychotherapy, which is exploration of behavior patterns and how to cope. Psychotherapy, cognitive behavioral therapy, is short-term, goal-focused form of psychotherapy that aims to change negative patterns of thinking and works to reframe negative thought patterns, life impairments, procrastination, time management, and others. Behavioral therapy, how to monitor your behaviors effectively and create change. Social skills training teaches new and more appropriate behaviors in social environments. All right, so now we're going to go ahead and speak about the medications and their mechanisms of action. So there's two classes of medications that treat ADHD. Those are the stimulants and the non-stimulants. Stimulants increase dopamine and norepinephrine. There's amphetamine-based stimulants. So amphetamine, dextromethamphetamine, methamphetamine, which its brand name is Disoxin. The legal narcotic methamphetamine is derived from the adulterated form of this prescription drug, and both forms are reported to cause psychological and physical dependence / addiction, withdrawal symptoms, as well as worsening psychological manifestations such as visual, auditory, and tactile hallucinations. And this is not an exhaustive list of side effects. There's sir-dexmethylphenidate, dexmethylphenidate. Methylphenidate, it's an NDRI, but not classified as an antidepressant, and lisdexamfetamine. The non-stimulants, they have several different mechanisms of action. There's selective norepinephrine reuptake inhibitors, like atomoxetine and viloxazine, tricyclic antidepressants like nortriptyline, clomipramine, or imipramine, or its metabolite desipramine, norepinephrine dopamine reuptake inhibitor antidepressants like bupropion, serotonin norepinephrine reuptake inhibitor antidepressants like venlafaxine, monoamine oxidase inhibitor antidepressants such as phenelzine and tranylcypromine, and adrenergic alpha 2 agonists like guanfacine and clonidine. There are also some natural remedies and nootropics out there. Levodopa or L-Dopa is an over-the-counter supplement that is a precursor to the neurotransmitters dopamine, norepinephrine, and epinephrine. Nootropics, also known as smart drugs, are a diverse group of medicinal substances whose action improves human thinking, learning, and memory, especially in cases where these functions are impaired. An example is Thesis or Stasis. There are two different brands, but the main ingredient is the same. It's high dosages of caffeine that are beyond the daily consumption recommendations by boarded human medicine cardiologists. And their other ingredients contain various non-FDA approved herbal supplements. Okay, so the amphetamine-based stimulants increase the levels of dopamine and norepinephrine in the brain. Dopamine helps to synthesize norepinephrine, so inadequate levels of one may mean inadequate levels of the other. Most effective and most researched method of treating ADHD, research shows that increasing the amount of circulating dopamine and norepinephrine neurotransmitters in the brain is the most effective treatment for the clinical signs and symptoms of ADHD. They're available in immediate release and extended release versions. The NDRI methylphenidate, which is Ritalin, Concerta, and others, is a norepinephrine and dopamine reuptake inhibitor stimulant medication, but is not classified as an antidepressant. So there's been reported personality changes on amphetamine-based stimulant medications. As long as the dose is correct, the medication should not affect your personality or sense of humor. What it will do is curb your hyperactivity, inattention, and impulsivity. An excessively high dose could temporarily flatten your personality, causing you to seem unusually quiet or withdrawn. If you or someone close to you notices such changes after you start taking a drug, alert your doctor. He can lower the dose or switch you to another drug. Any changes to your personality are transient. Nothing is permanent. If you don't like the way you feel when on a stimulant, tell your doctor you'd like to stop taking it. So we're going to talk about what reuptake is real quick. So reuptake is what happens after a signal is transmitted. The neurotransmitter, its work completed, is reabsorbed back into the cell that previously released it. Reuptake is essential for synaptic functioning. It allows neurotransmitters to be reused and helps regulate neurotransmitter levels in the synapse. So non-stimulant medications, selective norepinephrine reuptake inhibitors like atomoxetine and viloxazine, they solely work to increase norepinephrine and epinephrine without addressing dopamine levels. Tricyclic antidepressants like nortriptyline, clomipramine, or imipramine, or its metabolite desipramine, inhibit the reuptake of norepinephrine and serotonin. It's a third-line treatment option. Norepinephrine dopamine reuptake inhibitor antidepressants like bupropion. It increases norepinephrine and dopamine levels and is also utilized for smoking cessation. Serotonin, norepinephrine, reuptake inhibitor antidepressants like venlafaxine solely works to increase serotonin and norepinephrine without addressing dopamine levels. We learned in a previous slide that addressing the norepinephrine and dopamine levels together is the best way to go ahead and combat the signs and symptoms of ADHD. So, MAOIs or monoamine oxidase inhibitors are a group of antidepressants that can treat ADHD with some benefit, but they're rarely used because they have dangerous side effects and can cause serious problems when you take them with certain foods, drinks, and other medications. They may help people if no other medications have worked. Examples include phenelzine or trianylcypromine. They work to increase serotonin, dopamine, and norepinephrine levels. They can cause serotonin syndrome if you are taking other medications which boost serotonin. They can also cause an acute hypertensive crisis, cardiac dysrhythmias, can lower the seizure threshold, intracranial hemorrhage, orthostatic hypotension, hypermetabolic syndrome, hypomania, respiratory and or CNS depression, leukopenia, and more. This is not an exhaustive list of side effects. The adrenergic alpha-2 agonists like guanfacine and clonidine, stimulants increase norepinephrine activity, but alpha-2 agonists inhibit norepinephrine release. So how can they treat ADHD? The answer lies in their downstream effects. Alpha-2 agonists strengthen norepinephrine signals in the prefrontal cortex that are critical in mediating attention and behavior. Other mechanisms are likely involved. For instance, their effects on the locus I'm never going to be able to say this right. Coeruleus may attenuate inattention, hyperactivity, and impulsivity. Overall, the alpha agonists, particularly clonidine, are not very well tolerated with dropout rates that are higher than average for psychiatry. Dry mouth, constipation, fatigue, sedation, somnolence, hypotension, rebound hypertension, bradycardia, and QTC prolongation are all impediments. And this is, again, not an exhaustive list of side effects. So, medical management mechanisms and coping strategies. The most highly recommended treatment plan for ADHD includes behavioral talk therapy combined with daily medicinal therapy for ADHD and any other psychological neurodivergent behavioral comorbidities that are present. Making lists by prioritization, performing a task the same way each time, so pattern recognition, performing calculations twice, then having them checked by a teammate for verification, closed loop communication. Those of you that are Recover certified already know what closed loop communication is. But essentially, for those that don't know what closed loop communication is, it's where you go ahead and put, something out to your team and somebody immediately responds back that they've received your message by responding with a portion of your message included so that there's no question involved. ADHD spectrum testing, or the 7 types of ADHD. There's several tests available online, both free and paid. If you fall under more than one category type, you are considered mixed type ADHD. It's good to go ahead and take one of these tests so that you can identify where it is that you lie on the spectrum. Monitoring symptoms, mood, and procrastination over time with apps like Schmoody, so you can have metrics to take to your mental health practitioner to show how you're responding to your medication and dosage. And some provider networks to provide you all with. The Neurodivergent Veterinary Professional Support Group from VIN Foundation is called Vets for Vets and Support for Support. These are confidential groups for veterinarians and veterinary professionals whose brains function in ways that may be dissimilar to the general population. Neurodivergent Vets is specifically for veterinarians, while Neurodivergent Veterinary Professionals is open to all veterinary professionals. You would be able to have a one-on-one private session over the phone or computer with a Venn Foundation Vets for Vets or Support veterinarian and trained mental wellness supporter. Receive customized peer support and or referral guidance, and join confidential online groups with message boards full of topics and useful information. And this is all for free. Some online ADHD mental health provider websites that offer medicinal therapy. There's ADHDonline.com, redboxrx.com, donefirst.com. This is the website I've utilized for the past 3 years and I highly recommend. ADHDonline.com. Oh, I put that twice. I apologize. Plushcare.com. And some sites are not available in every state, so make sure you're checking that. Ensure you verify they're active in your state. Pricing varies between sites for initial assessments, consultation sessions with your provider, and or monthly subscription fees. So please read carefully. Some sites offer solely ADHD treatment. Some offer only non-stimulant medications, whereas others will prescribe stimulant medications for you. Some sites also offer treatment for comorbidities, such as depression and anxiety. Some sites will accept your insurance, whereas others will not. And so you just really need to, delve into what it is that they provide. Finding a local ADHD mental health practitioner for in-person therapy. So ZocDoc.com is a really easy way to go ahead and locate someone that's local to you. And your insurance provider's web database of in-network practitioners is also a great place to start. All right, so I'm going to hand it over to Suzanne now, okay?
Hey, thank you so much. That was super, super incredibly informative. So thank you so much, Kristen.
Yep.
We're now going to shift into how we can support our team members that have ADHD or other neurodiversities. But before we get into that and how we can support our teams, I want to share a little bit about me, because if I'm not a familiar face to you, you might be wondering, who is this? And how in the world is she qualified to talk to me about this? You can go ahead to the next slide.
Sorry, hang on.
Next slide.
No, there we go.
All good. So first off, hi, I'm Suzanne. I have 2 bachelor's degrees, one in business, one in veterinary technology. What you don't see here is that I also have in college, I had a minor in women's and gender studies as well as psychology. So there's a lot of background there. I'm also a licensed technician in New York State, certified compassion fatigue professional, certified veterinary business leader, and an NASM certified personal trainer. I've been in vet med for just about 14 years, actually just over 14 years. And over the years, I've had many leadership roles, from retail store manager before vet med to lead oncology technician to hospital manager to regional operations director, where I sit currently. And then in 2023, so last year, I founded Leading Veterinary Teams, a coaching and e-learning site to help veterinary managers and leaders learn how to lead their teams in the way that we've always wished that we had been led ourselves. And then I also started Vet Fit Club, which is a fitness app and community geared towards veterinary professionals, which is launching soon. It is not officially launched yet. And despite seeming to have it all together most days, I am dyslexic. I have had a handful of mental health disorders that I've had to navigate personally, but they've also made me very sensitive to those that I lead. So we are going to, you can go ahead to the next slide. We're going to, for the rest of this time, we're going to dive deeper into how ADHD and neurodiversity affects us in vet med. We're going to focus on how, as veterinary leaders, we can support our neurodiverse teams, how we can create an inclusive work environment where inclusivity includes neurodiversity. We'll talk about structured and clear communication, and then touch on some ways that we, as neurodiverse leaders ourselves, can then support ourselves. So I'm actually going to just ask for 2 seconds because my kids are in the room and I'm about to talk a little bit about my personal journey. And while they are young and probably not paying attention, I'd prefer them not to listen to this. So just give me 2 seconds.
Hmm.
Thank you. Sorry. So, as I've mentioned, mm, okay, just leave them. It's fine. So, as I've mentioned, I have a handful of mental health disorders and struggles that have affected my life. I want to preface this with sharing that this is not at all for attention, sympathy, or honestly, even empathy. I share these things so that you understand that mental health is complex. And I personally feel that it doesn't really sink in on how complex until you hear someone's real life story. As a child, I mentioned I was diagnosed with dyslexia. I never really thought of it as something that was an issue until I was in vet med. Um, Kristen just noted a few minutes ago about distractions and calculating drugs. I've always known that I have to count things more than once, and I've always often asked someone to check that whatever the number is that I have, that I haven't messed up. Uh, Quickly in vet med learned that I cannot get distracted when counting pills or be rushed when filling meds or calculating drugs because it's easier for me to make mistakes since numbers are personally a challenge for me. When I was in elementary school, I came home to find a family member attempting suicide. To protect their privacy, I'm not going to go into specifics here, but witnessing and then helping this individual stop their attempt was a very traumatic experience for me. I had a verbally and emotionally abusive grandparent causing additional trauma and was sexually assaulted by a 26-year-old man when I was 12. In 2006, after a really ugly breakup with the person at the time I thought I was going to be with for the rest of my life, that obviously did not pan out the way that I thought. But I began to have suicidal ideations, which luckily for me, I had an incredible support system through my mother who recognized some of my behaviors based on her own history and refused to leave me alone. I will always, always, always be thankful for her literally saving my life on March 3rd, 2006. I'm pretty confident that I would not be here today talking to you all about this if it was not for her. Again, I do not tell you this to feel bad for me, but recognizing that these external factors happened has helped me understand how complex mental health is. Do I believe that without having had these things happen to me, that I wouldn't then struggle with mental health disorders? To be honest, no. But they sure have complicated them. That said, I spent many of my childhood years in and out of talk therapy, most of which was forced upon me. And I never really did find it helpful. But in 2019, in the middle of the absolute worst can't even speak, absolute worst panic attack that I have ever experienced, uh, I was in the middle of the treatment room at a hospital that I was managing. I called the Employee Assistance Program phone number and I asked for help. Now, I am not somebody who historically would be calling anyone for help, but this was a feeling unlike anything I had ever experienced, and I have struggled with panic attacks on and off my entire life. Luckily, because I was the manager at the time, I knew about the EAP. They set me up with a therapist, and Ebony and I have worked together ever since. I pretty much got to work immediately. I was really, really lucky meeting her because I know from past experience that therapists don't always treat you like a person. But Ebony was different. I told her of my past. I told her it was forced upon me and that I didn't need her to ask me about my relationship with my dad. I told her that I don't want to talk about things that make me angry. I wanted to talk about coping mechanisms. And when I'm ready, maybe we'll talk about that stuff. After a while, I finally was open to trying anti-anxiety medications. Um, my the person in my family who I mentioned before was on an antidepressant, and that caused him, them, them to attempt suicide. And so I was always very against medication, but I was finally open to trying an anti anxiety medication. But interestingly enough, by reducing my anxiety, it brought up a lot of other things, some good, like deep work and time blindness that I have definitely used to my advantage, but some not so great, pretty serious emotional regulation issues. So last year, as I mentioned, I was diagnosed with ADHD in 2023 because I started asking about it. I started doing research on ADHD. And then I also asked the question on whether you could live with ADHD and anxiety at the same time. And the answer was profoundly yes. This also led me to diving deeper into how frequent ADHD and other neurodiversities occur in vet med and how I could help support my teams as a leader now that I know so much more about ADHD and how it affects us. So I started asking more questions about ADHD, as I mentioned. And then it kind of went down this rabbit hole of other mental health disorders in vet med. And as my own experience shows, it's all very complex, right? But I found that veterinary professionals have a higher risk of ADHD due to things like the inflexibility of employers, hostile clients and colleagues, a lack of empathy from our leaders, and just a general misunderstanding of what neurodivergence is. Understanding that our profession is at a higher risk for compassion fatigue, burnout, and suicide, as well as a higher risk for ADHD and other neurodivergence. And then realizing that it wasn't just me has helped me as a leader support my teams, which continues to drive me to help you support yours. So I've thrown around this word neurodiversity a couple of times, right? And I know that we are talking specifically mostly about ADHD, but it's important to note that neurodiversity is a natural variation in human neurocognitive function. So that is a very what I'm sorry if you just heard my son laugh. That was not a funny thing I said. But we are talking primarily about ADHD here, but it is important to remember that neurodivergence is super complex. And there are a lot of different things that can contribute to what is considered neurodiversity, because again, it is a variation in cognitive function. So you may have neurodivergent team members and not know it because neurodivergent people consistently mask differences to seemingly be accepted in the world. So, masking can create its own host of problems, including the inability to truly know how many people are affected by ADHD and other neurodivergence. But what we do know is that up to 15 to 20% of the world's population exhibits some form of neurodivergence, and neurodivergent people tend to be drawn to animals. So it's safe to estimate that this percentage is much higher in our veterinary professional. So knowing this information is only one part, right? If we know the information and do nothing with it, that's just neglect. And we have a responsibility as leaders in the veterinary space to be better for our people, especially as we learn more. But before we dive into that, I want to take a minute to talk about the responsibility with a quick video clip from Simon Sinek. Hopefully this works. Yeah, I don't hear it. Well, that's all good. I will summarize for you. If you want to go to the next slide, it is a very quick summary. All good. The next slide gives me my summary. Essentially, we are responsible for those that are in our charge as a leader. A lot of times, leaders, we don't we're managers for the most part, right? We are managing things, and we are focused on. If you ask he says in Simon Sinek says in that, not in that clip, but in that presentation, in that speech, that he asked a CEO what the CEO's top priority was, and he said his customer. And then he laughed and said, "You haven't seen a customer in person in over 15 years. How is that what you're focused on? Your focus is the people that then actually care for your customers." So as a veterinary manager, let's say, right? I'm a hospital manager, for example. My responsibility is not the patients. My responsibility is the people that are taking care of those patients. So as a leader, you are responsible for those in your charge, whatever that means for you. If you are not a leader by title, that doesn't mean that you're not a leader. Some people have a lot of trouble with this, so stick with me. Let's say you're an associate veterinarian or a credentialed technician. Maybe you're a receptionist that has been at the clinic for just under a year and your hospital just hired a new receptionist. I hate to be the one to tell you this, but if somebody is looking up to you, and when somebody's looking up to you, right? And when somebody's looking up to them, you are a leader. You don't have to be the hospital manager. You don't have to be the medical director. You don't have to be the CEO of the company. If you are there one day longer than they are, you are a leader to them. You know more than they do in whatever it is you're doing. So this means that you have a responsibility to care for the people around you. And even though we weren't able to watch that entire clip, Simon Sinek does say that not everybody wants to be or is even good at leadership, but that does not mean that you do not have the responsibility of being a leader. So I want to show you guys this slide. It's one that you've already seen. It is the slide that Kristen showed earlier about the symptoms of ADHD that are experienced on the job by veterinary professionals, right? These are just a few. Trust me, these are just a few. Reading this list and reflecting back on this list, are there any things that you recognize in yourself? Are there any things that you recognize in your team? Imagine being someone, let's say you're neurotypical, right? You have no problems. You don't have ADHD, you don't have any of these issues. Your brain works perfectly. Could you imagine being somebody that has to deal with one of these things, let alone more than one? And sometimes, especially with someone that has multiple issues that are all happening at the same time, all of these on the job symptoms can happen maybe not at the same time, but all in one day. It's exhausting, right? So just imagine those around you feeling or experiencing these things. For me, emotional regulation has been my biggest challenge, especially as a leader. And I kind of mentioned this before. You can go ahead to the next slide. I am super, super passionate about things that I'm involved in. I feel emotions very intensely. And I never knew that this was a symptom of my ADHD. But now that I do know that, it all really makes sense. I've had to learn how to manage my emotions through talk therapy, coping mechanisms, medication, and honestly diving into emotional intelligence work, which has really, really helped me personally reduce my anger, which is usually how my emotions come out, and anxiety. Uh, Personally, uh, it's funny now, but when it happened wasn't funny. I've had moments where even in a leadership role, because I get so attached and so passionate, at least that's the word I've always used to describe it, about the work that I do, that there's this ownership. And so when someone else has anything or has had anything to say about what I'm doing, I've gotten very defensive and, like I said, was very angry about things. And so I've had to learn through managing my ADHD and all of the things that come with it, I've had to learn how to manage this emotional dysregulation and cope with it. And it's not always perfect, trust me, but I have learned very slowly, and I'll share some resources at the end on how. But before I go any further, I do want to note that ADHD and other mental health disorders increase the risk of suicide for the general population. And as we know, veterinary medicine is already at an increased risk for suicide due to the unique stressors like euthanizing patients with treatable illnesses, the emotional toll that it takes on us when clients cannot care for their pets for whatever reason, and this overarching expectation, whether it's real or assumed, that we don't care because we ask for payment for our services. Remember, ADHD is rarely the only mental health disorder that a person has. It can often be masked by other disorders like anxiety and depression, in my case, or other mood disorders, even substance abuse. And the problems with emotional regulation, all coupled with the vocation where we're constantly battling every emotional situation, can all have an effect on suicidal ideation. So, what do we do? First of all, it is important to assume good intent. Now, this concept is something that is very, very big in the emotional intelligence books and classes and information that's out there in the world. But it's an important concept and something that really changed the way that I look at how I interact with other people and has helped me help other people in understanding the people that they lead. So hopefully this is helpful for you if it's not something that you've heard before. So most people are not walking around telling everybody about their mental health struggles and trauma history, right? This is probably the first time that I have publicly told a group of people that I do not know, mostly, uh, my trauma history, right? Most people are not actively looking for opportunities to tell people about their problems. Most people that are living with ADHD are living in silence, masking symptoms to appear normal, and most people care a lot, so they don't want to burden you with their problems. Sometimes this can show up in your team members showing up late to work, taking off extra days, being easily distracted, making medical mistakes. So assume good intent because most people are not doing these things intentionally to make your life and your job harder. We want to provide clear expectations and structure whenever possible, clearly outlining job expectations, responsibilities, and deadlines for your team members. Establish a structured work environment as best as you can with clear routines and workflows because this really helps people with ADHD stay focused and organized. Routines, routines, routines. Consider offering flexible work arrangements. Now, I this is probably going to be triggering for some who actually manage a veterinary hospital because I understand that we typically have very long shifts in vet med. Even general practice, you're open 8 to 6 or something of 8 to 8, whatever, you have one person working that full shift, right? And so asking for flexibility with work arrangements might initially be like, what does that even mean? But this is an opportunity for us as leaders to get innovative. Maybe it's considering short 6 hour shifts. Maybe this thought of having 3 really long days is good for some, but others, like people with ADHD, to manage their workload more effectively and minimize distractions, a shorter shift might be something that works better for them. Incorporating visual aids and checklists. I know, another checklist. But incorporating these things into daily tasks and procedures can help team members with ADHD stay on track and prioritize their tasks. Include visual reminders wherever you can, and this will help guide workflow and reduce forgetfulness. Encouraging regular breaks. This means, yes, you actually have to take your break, and physical movement throughout the workday to help your team members manage their energy levels and stay focused. Short breaks can provide opportunities for relaxation and rejuvenation. And a lot of times, honestly, I'm a huge fan of the squat break, right? Everybody just kind of get in a circle and start moving your body. Go for a walk if you can. If you have a place where you can have where a quiet area where people can relax, it will improve overall productivity, even though it feels like you're stepping away. When you step away from things, you're able to allow your body and your brain to reset and recharge. You can offer training sessions and resources on time management, organization skills, coping strategies. Providing this ongoing support and guidance can help your team develop effective strategies for managing their own symptoms and improving their own performance. You can create a supportive and non-judgmental environment where team members feel comfortable discussing their challenges and seeking assistance when needed. Now, this does not mean that we all just kumbaya in the middle of the treatment room and talk about our feelings, right? If that works for your team, that's great, but that's not what I'm talking about. I'm talking about having a supportive environment, whatever that means for you. For me, a supportive environment would mean knowing that I can come to my leader in confidence and knowing that I can tell her or him whatever it is that is going on and know that I'm not being judged for it. Encouraging open communication and regular check ins helps to address any concerns or difficulties that your team members are encountering. Maybe there's some family thing going on, and maybe you just recognize that they're not really acting their normal self. Just saying, hey, everything okay? Because I noticed that you're kind of off, instead of being like, hey, Suzanne, why didn't you do this today? It's much more supportive when you come at people with the question that is leading with empathy than the finger pointing and you didn't do your job right today. You can pair team members with mentors or peers who can provide guidance, support, and encouragement. Recognizing and celebrating achievements and contributions to your team can help boost people's confidence and morale. This is probably generally everyone, but definitely people with ADHD. A lot of times, I know Kristen mentioned it too, imposter syndrome is a huge thing. And so making sure to celebrate people and their contributions can really help that. Positive reinforcement and recognition can motivate people to continue performing at their best. But communication here is super, super important. So make sure you ask your team how they want to be celebrated, because not everybody wants to be the center of attention. Encouraging a healthy work-life balance, or what I personally prefer is work-life integration, because for me, there's a ton of overlap between what is my work and what is my outside life. A lot of it is very much the same. I know Kristen would probably agree here. Most of our life is work and work is life. And so not everybody is that way, but regardless of how you look at it, whether you're looking for balance or balance is pretty much impossible because you just have integrated everything together. It's important to respect boundaries regardless, right? I have my boundaries. There are times, whether it would be with my family or with my job, I have had to create boundaries and promote self care practices. So, encouraging your team to prioritize self care, whether that's exercise, like I said, big fan of squat breaks, relaxation techniques, or hobbies outside of the clinic. And this can be together or separately. So, hey, you really enjoy fishing, go fishing, right? Go take your PTO. I just had this conversation yesterday with one of the managers that I oversee, and she reached out to me about a PTO request, and I was like, "You have PTO? Take your PTO. I'm not, please take your time. You have the time, take the time. You work far too hard for me to tell you no, you can't take PTO." Moving along. Regularly seeking feedback from your team helps you to understand their needs and preferences, and that allows you to then change things. But here's the thing, you have to be flexible. You have to be willing to adapt and adjust to support your team based on their feedback. So, getting the feedback is one thing. It's just like I said before, right? You can only do so much with information if you do nothing with it. If you just have the information, cool. It's like benign neglect when I fail to bring my dog to the vet after he eats the chocolate chip cookies right before this meeting, right? You can go to the next slide.
There we go.
So I found this image and I really, really loved it because it's a reminder that everyone is different. We hear DEIB and we think, I mean, at least for me, I think racial differences, I think men and women, I think, or any of the various, you know, genders. Sorry, the word wasn't coming to me. Uh, we think all these things, right? We think sexual preferences, we think all of these things, but we don't typically think, at least I don't typically think, that DEIB has anything to do with neurodiversity. I personally would not, before doing some of the research that I did for this presentation, honestly didn't really think about the fact that DEIB was anything to do with me having ADHD. But it does, right? Because every brain is different, and creating environments that promotes psychological safety for our teams also promotes an inclusive environment. Sometimes when you don't think about it, you don't realize that it is totally relatable. And then I see this image and I'm like, holy cannoli, right? So I just really wanted to share because I thought it was really great. So knowing that, right? There are some strategies when creating an inclusive work environment that overlap. It overlaps how we can support our teams with ADHD because our support is essentially creating that inclusive work environment. The biggest one here is allowing flexible work schedules. And I told you before, it is probably triggering to any hospital managers out there. But when you allow your team members to adjust their work hours to accommodate their peak productivity times or manage symptoms of ADHD, it can really help with the difficulty to focus or any attention issues that they might be having. There's also some task management softwares and apps out there. I personally use Trello a lot, but there are plenty of other ones, Monday.com, Asana.com, all of these things that you can provide access to help your teams organize their tasks, set reminders, prioritize their workload effectively. You can honestly even suggest that they use Google calendars and things of that nature. I am always setting reminders on my phone, all of those things. So there's just apps and softwares that allow you to do it a little bit more effectively, especially when you're not used to creating those routines for yourself. Creating designated workspaces or zones within your hospital at wherever possible so that individuals with ADHD can minimize distractions. For me, distractions are huge. If you are watching this in the replay, you will see that there beginning of my part where I'm talking, my kids were in the room and I was like, right? But now they're not here, so I feel so much more relaxed talking right now because I don't have that interruption. I am now sitting in a quiet space. Any parents know that quiet spaces are very hard to come by when you have children, but the point here is when you minimize your distractions and you minimize distractions for your team members with ADHD, it allows them to focus on their tasks without interruption. It also gives them a place where they can step away when things become overwhelming. Because to be completely honest with you, if you don't already struggle with a neurodiversity, there are so many things that come at you that can become very, very overwhelming. And sometimes just stepping away for a few minutes in a safe, quiet space can really, really make a big difference. And then again, establishing those clear communication channels such as team meetings, email updates, or instant messaging platforms to ensure that all information is conveyed effectively and consistently for everyone is a huge, huge game changer for people with ADHD. So creating a communication creating structured communication benefits neurodiverse teams by providing a clear framework and guidelines for interaction, which helps reduce ambiguity and all types of misunderstanding. A huge issue with people with neurodiversity, specifically ADHD, is ambiguity which is a hard word for me, but ambiguity and needing clear guidelines. So when I am getting a job, I am always, always, always saying to my future employer, the one thing that I need is clear guidelines, and I need you to tell me clearly what you expect from me, right? I need clear expectations because I need to be working towards something. And when things are super ambig, I can't say that word. We are having word issues today. When things are full of ambiguity, I personally struggle. My past role was there was not very black and white, and I struggled with it a lot. I am a task-oriented person by nature, and so for me, this structured communication is very, very helpful. Honestly, people that thrive with ambiguity, this is not going to hurt for them either. But creating clarity and predictability allows neurodiverse individuals to thrive because we thrive in environments with clear expectations and, like I said, routines. Neurodiverse individuals may interpret communication differently or struggle with social cues. So, I don't personally struggle with social cues, but there are plenty of people with neurodiverse issues, including ADHD, that struggle with social cues. So, structuring your communication ensures that messages are conveyed clearly and concisely, minimizing that risk of misinterpretation or confusion. There may also be some difficulty filtering out irrelevant information or staying focused on the task at hand with someone with ADHD. So, structuring communication helps to maintain their attention by presenting information in a logical, organized manner. Neurodiverse teams may struggle with coordinating tasks or working together effectively. So, by creating structured communication, collaboration is then fostered through those clear roles, responsibilities, and expectations. As I've mentioned, neurodiverse individuals may face barriers to participation in group discussions or meetings, right? Because not everybody wants to be the center of attention. So, structured communication ensures that everyone has the opportunity to contribute to by providing those clear guidelines for turn taking and sharing ideas. So, overall, structured communication creates that inclusive environment where neurodiverse individuals can thrive by providing clarity, predictability, and equal opportunities for participation. So, I wanted to share a few ways in which we can structure communications in our clinics by for both our teams as well as sometimes even our clients. One way is through a centralized scheduling system or software that allows our teams to coordinate appointments effectively, especially in large specialty clinics with multiple moving parts. I personally have worked in specialty clinics where I was an oncology technician and we needed to schedule an MRI or a CT scan, and a different department was the department who scheduled that. So having a centralized system allowing us to communicate department to department is very, very helpful in those situations. Otherwise, it is a free for all, and that is not good for my brain.
Mm.
Using EMR and PIMS or a practice management software, for anyone who's not familiar with the term PIMS, instead of paper records, yes, there are still very many, unfortunately, very many clinics who still have not gone paperless, believe it or not. But utilizing these softwares allows our teams to access information timely. So it supports the staff, it supports the treatment of our patients and allows for timely interventions. But it honestly allows us to have that communication in place where we can see what's going on all in one place and we can read it, right? Please raise your hand if you have ever tried to read somebody's handwriting,
Mhm.
especially doctors. Right? I mean, come on.
Mm.
We can use email or secure messaging platforms. This allows our teams to communicate to clients, but also enables us as veterinary professionals and doctors to uh, make decisions, to plan treatments, etc. So, yes, we have diagnostic test results that can be sent out in a way that can be either, through a secure text messaging platform or whatnot, but really ultimately is then housed in that EMR or the PIM system where we can then all see it. So it's going back on that same thing that we were just talking about. And then we have our surgical planning and follow-up, right? So same as what I was talking about before with scheduling softwares, we can utilize these scheduling softwares. We can also utilize checklists to make sure that everyone on the team knows the schedule, the patient care protocols, and minimizing errors. So if everything is digital and everything is all in the same place or in a place where people know about. Again, this is the clear communication that I'm talking about. It needs to be in a place. It's great if you have the information, but if the information is here and there and there and there and there, well, where do I go for it, right? So if you have everything compiled, all your checklists are in this file and all of your scheduling is here, and everybody is trained on that and knows that, then you're able to minimize those errors and everybody is communicated with and knows what their expectations are. And then again, we have our client education and communication, so we can utilize online resources. You have the PIMS to document communication, and ultimately, this communication being documented allows everyone to know what the clients have been told, right? Because what is the worst thing that happens when you call a client and the client's like, yeah, so and so already told me that? That makes you feel really great, right? So making sure that all these things are documented and having this place for it allows everyone on the team to know what's going on. And then lastly, we foster a collaboration through team meetings, especially when we utilize Zoom conferencing or other types of conferencing. Now, I know that there's lots and lots of things on the internet that are like, couldn't that have been an email? But there is something to be said about having these regular team meetings and training sessions. I would, as a leader, be very, very cognizant about the regular team meetings being scheduled in advance and not being last minute because that's just gonna, for lack of better term, piss people off. So if you want to communicate what you have going on, have a regular cadence, right? Every Tuesday, you get these emails about XYZ. Every 15th of the month, we have a full staff meeting. Without fail, consistency, consistency, routines, remember? And so we collaborate, we foster this collaboration by utilizing these things. But I specifically want you to remember to utilize video conferencing as much as you can, especially with neurodivergent teams, because while having everybody come in is really, really great, not everybody has the capacity to be in person all the time. Remember work life balance, but also there's a lot that goes on with somebody who has neurodivergence, specifically ADHD. And there are definitely times where if I am forced to come in, I am not paying attention at all because I do not have the capacity to be in a room full of people. And so it's really important to give people the option. And this is where we go back to what we were talking about before of being flexible. So have the option of video conferencing like Zoom. Now, I'm also going to really quickly mention here that while I am a fan of cameras on, in order to be inclusive, allow your team members to keep their cameras off. This also will maintain a culture of trust and safety for your team. So, overall, clear communication channels play a crucial role in enhancing your team's collaboration and productivity. By leveraging these channels effectively, your teams can deliver high quality care and improve patient outcomes, all fostering that culture of inclusivity and trust. So, clear communication channels are essential for enhancing team collaboration and productivity by facilitating effective task assignments, timely updates, streamlining decision making, reducing email overload, enabling remote collaboration, and improving accountability and ownership for the team. Before we go, I've talked a lot about ADHD and neurodiversity affecting our teams and our responsibility as leaders to support them. But I'd be missing a huge part of this if I ignored the fact that this also affects you and me. So, as a leader in veterinary practice, I've encountered my share fair share fair dyslexia, my fair share of challenges. There have been many times when I mentioned this before, my emotions got the best of me to the point where I have forgotten in the moment what all of my hard work was for. I remember instances where I have become defensive when someone has suggested changes to my work, feeling like it was undermining my efforts and my expertise. But something changed along the way. Came across this book, No Ego. Actually, I'll be honest, I didn't come across it. My leader handed it to me. But for now, we'll say that I came across it. And it was my first real introduction to the term of emotional intelligence. Reading it was the start of my understanding of what emotional intelligence was, and it was a real turning point for me. It's helped me understand the importance of emotional regulation and how it can positively impact not only my work, but also my relationships with my colleagues and my team members. I mentioned before that seeking support from a therapist was a game changer. It absolutely was not easy to advocate for myself, but I knew that I needed to try different approaches to manage my anxiety. And later learning that I also had ADHD, I had been managing that I did not know that I was managing, albeit not very well. But after much deliberation, after deciding to try medication for my anxiety, and most recently, also trying medication for ADHD, it has made a significant difference in my ability to focus and stay organized. Having this experience personally has driven me to want to offer you some insights into self growth and leadership development. And firstly, that starts with knowing that you're not alone. And I hope that me telling my story tonight has shown you that you are not alone. There are others out there facing similar challenges, and seeking support and guidance can make a world of difference. In this left hand picture over here, that was at the hospital that I had a complete meltdown in. The second picture over here is working in a corporate office and having a lot of unknowns, right? Ambiguity was everywhere, and it was one of the best roles, but one of the hardest roles for me. And then again, No Ego was introduced and totally changed my world, which has truly, truly driven me to starting leading veterinary teams. And I've learned through all of this experience that we shouldn't be afraid to explore different strategies and tools to manage our own symptoms. Maybe it's reading books on emotional intelligence. That tends to be not emotional intelligence specifically, but reading books. I have a very large pile of books right next to me over here that I had to hide because I didn't want you guys to think that I was a book hoarder or something. But reading books, seeking therapy, trying medication, you need to find what works for you. And lastly, embrace your strengths. Living with ADHD and other neurodiversities come with its own set of challenges, but it also brings unique strengths such as creativity, adaptability, resilience. Recognizing and harnessing the strengths can help excel you in your role as a leader, make a positive impact with your team, but it can also totally change your life when you look at it that way. So, as leaders, we tend to put the needs of others before our own and neglect our own well being. And this can lead to burnout and diminished effectiveness. So, here are just some things that can help you. I know because it's helped me. Setting clear goals and priorities, breaking down those big, large tasks into smaller, manageable goals based on importance and urgency, utilizing to do lists and calendars, or like I mentioned before, task management apps to stay organized, creating structured routines. Now, I am asked all the time. I know we're talking about veterinary medicine, but I also mentioned I'm hugely into fitness, and I'm asked all the time, Suzanne, how do you get to the gym at 5 o'clock in the morning? You must have so much dedication and motivation. And the answer is absolutely not. I have neither of those things. I have created a structured routine, and I know that if as the hardest thing I have to do is get out of bed, everything else is in 100% a routine. and it is in order for me to get out the door. So establishing that consistent routine has allowed me to do that. And that goes across everything I do, right? So establishing consistent routines and rituals, streamlining workflows, minimizing distractions. The moment I have to turn around and come back to my room is the moment that that whole routine goes out the window. So setting things like specific times for your email management, time blocking. If you don't know what time blocking I do not have enough time tonight to go into all of the things specifically, but time blocking, write it down right now, Google it. It's a game changer, right? But setting times for email management, team meetings, strategic planning, all of this creates predictability and helps you with any type of ADHD or neurodivergence. Delegating and collaborating. Delegating can be very, very hard for people like me who like to control all of the things. However, you have to realize that you cannot do everything, and sometimes you do have to delegate tasks to your trusted team members and leverage their strengths because you, me, I'm talking to myself right now, are not good at everything. And so you hire people to be able to do a job, and oftentimes we hire people that can do jobs that maybe we don't do, right? So leverage their strengths. Fostering that culture of collaboration, open communication within your team maximizes productivity and honestly, even innovation. Practicing mindfulness and stress management, whatever that means for you. This could mean deep breathing exercises, meditation, yoga, walking. Walking is something that I think we do not give enough credit to. And honestly, just taking those regular breaks throughout the day to recharge and prevent burnout. So we talk about doing that for our teams, but we also have to remember to do that for ourselves. Seeking professional support was always very tough for me, but after doing it, honestly, don't hesitate to seek support. This can be from a therapist, it can be from a coach or a mentor who specializes in ADHD management, or maybe just experiences it themselves, right? If you're a veterinary leader and you are looking for a mentor, that's kind of what I do, right? And I also am very open to the fact that I have ADHD, so I'm happy to share the things that have worked for me. Is everything going to work for you? Maybe not, but we can work together and don't don't hesitate to seek support because this support can provide valuable insights, guidance, and accountability to help you navigate your own challenges and achieve your goals. And then as always, you want to set boundaries and practice self advocacy because setting those clear boundaries between work and personal life, or even just setting those boundaries with people at work and setting those boundaries with people in your personal life, like I mentioned before, can help you maintain a healthy life just in general. Advocating for your needs. So if you are just having a no people kind of day, tell your people around you that I'm shutting off today. My all of my meetings are getting canceled. I cannot people today. Communicating openly with your team makes you more human to them and also allows you to manage your ADHD symptoms and show them that if you're doing that for yourself, you're more likely to do it for them as well. And remember, at the end of the day, self-care is not selfish. It's essential for our well-being and effectiveness as leaders. Prioritizing our own self-care and implementing some of these tips allows us to lead our teams with confidence, clarity, and resilience. And also, you cannot I honestly, this saying is so overdone, but you cannot pour from an empty cup. As leaders, remember, you need to work on yourself first and always assume good intent. Recognize that different is not bad, whether that is your team or yourself. A neurodivergent individual can bring a whole host of incredibly valuable contributions to your team. Acknowledge that these differences can truly enrich your work environment. Instead of viewing differences as deficits, they can truly offer unique talents and skills that enrich our teams and our hospitals. Communicate with your team, ask them what they need. Then regularly seek input and feedback from your team, but remember that not everyone is going to outwardly identify as neurodivergent. So just by asking for the input doesn't mean, or asking them what's going on doesn't mean that they're going to outwardly tell you. But being open to hearing their feedback and being empathetic to whatever is going on in their lives will create that psychological safety for them. And then here are just some additional things that you or your organization can do. You can design and implement training on neurodiversity. There's also a ton of information out there that you can utilize if you don't create courses, right? If you're not a content creator yourself, or if you're not in a position to be able to do that in your role, there are a ton of things and a ton of resources out there. A quick Google search will find it for you. Lots of things out there on training for your teams. You can include neurodivergent individuals in the applicant review and interview process. Now, this might be more speaking to people in a higher level than just in a hospital, but consider maybe bringing in somebody who has a different view during the interview process. Really big one for me is ensuring that your job descriptions and job performance standards are clear and explicit. So I mentioned before, as someone with ADHD, I need very clear expectations. So having your job description, it is actually one of the first things I always ask, like, hey, what's the job description here? Because I need to know what I'm expected to do. You can identify local or regional sources who can assist you with identifying a diverse range of applicants, right? There's lots of different sources out there, not just your internal sources. If you are in a position to be able to train or recruiters or hiring managers on inclusive interviewing processes, you can also, as a hiring manager yourself, take courses on inclusive interviewing practices so that you are asking questions that are not making people feel bad for maybe having an issue, or that you're legally compliant, right? You might ask a question and not even realize that you have just made somebody feel very, very bad because you didn't mean to, but you didn't know. And so learning these inclusive interviewing practices can definitely help. And then identifying internal and community resources that can provide guidance and support to both you and your teams. And then also ensure onboarding and that your workplace orientation processes are inclusive of all of your employees. So, onboarding should look the same for everyone. Your orientation process should look the same for everyone and should be available in ways that everyone can process the information. And most importantly, don't forget to take care of yourself. You cannot support the people that you lead if you are not supporting yourself. I am a slide ahead of you now. So now I am pretty much done, but I wanted to share a couple of resources before we go. So obviously, I did talk about some sensitive topics, one being suicide. So I have to preface this with, if you or someone you know may be contemplating suicide, or you are not sure and you are concerned, please call the National Suicide Prevention Lifeline or text home to 741-741. If you are in a leadership role and you want to learn more about how to help your team members and how to also recognize suicidal ideation or these other things that can then lead to suicide or suicidal ideation, there is something called QPR training: question, persuade, and refer. I do know of some organizations that do require this training for their leaders, and I think it is absolutely wonderful to do so, but there are others that do not. And so this is just an opportunity for you if you have not already taken this training. I think it's like $25. It's not that expensive to go ahead and take the training. There's also others that I haven't put on here, but there are also other resources out there, like not another, oh my God, what is it?
Not one more vet.
Thank you. Not one more
Yeah.
vet. They have a program called Lifeboat. So that is a program where you are basically paired with a another veterinary professional, and you are able to then talk through issues that you're having. They're basically like a anonymous mentor for you. Um, I mentioned before employee assistance programs. So if you work for an organization that is larger than just a mom and pop hospital, and some of those may also have this, but most large organizations have some who offer health insurance, often will have an employee assistance program. So if you haven't heard of it, I would ask about it, because most of the larger organizations that I've worked for or worked with do have it, and not everybody knows about them. And this does more than just therapy. I know I used it for therapy, but there's also assistance, financial assistance, not to give you money, but to help you understand how to manage your money. There's also childcare assistance and lots of other things that lawyers, all of that kind of stuff is part of most employee assistance programs. So definitely a big resource that a lot of people are not utilizing, and it's there for you, and your companies are paying for them. So go ahead and do that. And then, of course, I had to have my own little plug here. I do have a lecture webinar that I have done. It is on my site, lvt.vet, on emotional intelligence for the veterinary leader. So it dives a lot more into detail on emotional intelligence specifically, whereas here I kind of talked about emotional intelligence from an ADHD lens. That's just emotional intelligence from a general leader perspective. And then I have a ton of books that I listed. There are so many more. I am a huge fan of reading, specifically, really anything by Brene Brown, Simon Sinek, um, Kim Scott. Radical Candor is really awesome. Um, Crucial Conversations. So understanding how to talk to people. There's so many things that are out there that allow you to kind of learn about how to lead people. And when you take it from a lens of neurodivergence, especially when you are dealing with that yourself, it really changes the way that you read these books. So definitely would recommend taking a look at some of these, if not all of them. I don't get any money for saying that. I just really like these. So. And with that, I guess I know that there is a chat feature here if anyone has questions.
Yep. Let's see here. Okay. Let's see. Does anyone have any questions for us?
Questions, comments, thoughts?
We'll give you guys a few minutes so that you can write in the Q&A section. Okay, well, if no one has any questions, we're going to go ahead and finish up here. I've got a couple more slides to show you real quick. So let me go ahead and share my screen again with you all. And I think it's still sharing. Let's see here. Oh, here we go. Hi, I have an experienced vet nurse who has ADHD, and she often uses it as an excuse to be less productive than her coworkers. Suzanne, do you want to field that?
So, I personally have, when I was originally diagnosed with ADHD, I felt like I was using it as an excuse. I would dig in a little bit with this particular vet nurse that has obviously been open to sharing that they have ADHD, and so I would, not in front of the coworkers obviously, or hope that's obvious, but I would really have a empathetic conversation and say, hey, listen, Susie, I'll use my own name. I've heard you commenting that your ADHD causes you to be less productive, or whatever the words are that she's using. And I would ask, is there something that we can do to help you, to to feel like you're able to be more productive. So I think that where I'm going with that is to again lead with empathy, and instead of and I might be reading into the question a little bit, but I feel like there might be some frustration that she's using it as what you're saying as an excuse to be less productive. Maybe she truly is less productive because of her ADHD. And so are there things that you're able to do are there things that you're able to do to support her? Now, I'm not saying that as a leader, we're responsible for their own ability to manage their ADHD symptoms. No, that's not the case, right? I'm still responsible as an adult human being that I still have to manage myself. But if my employer has empathy and my employer understands as much as they can that I might need some accommodations to be a more productive person, then and they're able to provide those things, and I don't think that that's wrong. So I would definitely I would I would start there. It might wind up being a performance conversation. It might not really have anything to do with ADHD, and maybe she's just not a productive person and not the right person to be in your clinic. But I think that I would start with the question of what is going on, and is there something that I can do to help you so that that doesn't feel like it has to ride on the back of ADHD. I hope that makes sense.
Yeah, and to piggyback off of that, always lead, like Suzanne said, always lead with good intent, basically. And, I would have a direct conversation with her and see, what symptoms that she may be experiencing that are leading her to be less productive than her coworkers, and, see how you guys can navigate through that together, utilizing some of the ways that Suzanne had mentioned. Okay, the second question is, how do you deal with other team members who don't carry the empathy for other neurodivergent coworkers?
So for me, this is a culture conversation.
Hmm.
So for me, this is not necessarily other people having or not having empathy. I think that empathy and sympathy are often confused, and so before kind of finishing this thought, I just want to clarify that sympathy is saying, I understand this, but empathy is really being in it with people. And it is really hard for people to empathize when they're not in it. Um, Kind of a strange example, I think, or not strange, but a little off the topic example, but really helped me understand empathy is that I thought that I was empathetic to people when they were euthanizing their pet, but in reality, I had never euthanized a pet personally, one of my own, until I did. And then I experienced it. When I experienced it, I could truly have empathy. So I think that when and honestly, I even probably used the word empathy in this in the last hour a little bit wrong, eh, because unless you actually experience it, it is very hard to empathize with a neurodivergent coworker if you're neurotypical. So what I would honestly say is having that conversation, having leaving those places to be open, and if somebody is actively treating someone badly, then it has nothing to do with their neurodivergence, right? It is a part of your culture. As a leader, you do not have to allow for people to treat people wrongly, regardless of what it is, right? So this is talking about that inclusive workspace. If you want people to feel safe in your clinic, then regardless of whatever it is that they're feeling safe about, if somebody doesn't understand, well, let's have a conversation about it. Susie has ADHD. ADHD causes X, Y, and Z. Here's some resources for you to educate yourself about it. And then maybe they might sympathize, maybe they won't, but you can definitely, as a leader, you can say what is allowed and what is not allowed in your clinic and in your presence, if that makes sense.
So, yeah, I absolutely agree with everything that Suzanne just said. And honestly, I feel like, somebody that is displaying that they don't carry, sympathy or empathy for neurodivergent coworkers are just basically venting their frustrations on the floor. And, there's a level of professionalism that is expected of all of us. And that should not be tolerated, honestly.
Exactly. And that's
Um,
where, as a leader, you can step in and you can, again, pull that person aside, because I am not a fan of having these conversations in front of big groups, because you're then not creating that inclusive environment for that person, right? But you want to be sensitive to them. They're frustrated because Susie is being lazy or less productive, or whatever terms that are used. And so let's talk about it. Let's dig into this. Why are you frustrated and how can I support you as your leader? Remember, as a leader, your job is to support the people who are then supporting the patients and the clients. And so, how do we support them?
exactly. Does anyone else have any questions? All right, I'm
And I
going to go
am
to.
also I just want to share that I am super open to continuing that conversation. If you, um, Kristen, or the anonymous attendee that asked those questions, if you guys want to reach out and really continue that conversation and dive into the specifics, I'm happy to do that as well.
I'm just going to go into the last slides here that we have. Let's see
Mhm.
here. So I just want to thank you all for coming to this webinar tonight. Please don't forget to take the survey after the end of the webinar through the redirected link. Your feedback is important to us. Um, and some vetmedology upcoming live webinars in April 2024. We have the phone triage masterclass with Dr. Shadia Brayfedge of Vet Triage. And in May, we have the complete guide to ECG interpretation in veterinary medicine with myself and Lori Carpenter. And in June, we have Brian, my co-founder of Vetmedology's next lecture, Bandaging 103, wound management, wound dressings, and bandaging considerations. And there's more to be announced soon, along with a second date for April. To earn your certificate tonight, just go to vetmedology.com and create an account or subscribe for just $10 a month and navigate to the Your CE portal. And this webinar will be available to you by tomorrow to complete the required quiz to earn your free certificate of completion. And that's it. That's all I've got for you guys. So as long as you guys don't have any questions, we'll go ahead and wrap it up. If you need to reach out to Suzanne, you can reach out to her at suzanne@lvt.vet. If you would like to reach out to me, you can reach out to me at Kristen, Kristin, @vetmedology.com. And we're happy to help in any way that we can. All right. Thank you guys so much for
Cool.
coming tonight. We appreciate your time.
Thank you.
Mhm.
The webinar has ended. Thank you for joining. Goodbye.